I welcome you all 2024 live sessions with Dr. Kalathia sir. I'm very grateful and thankful for sir to give me this opportunity. And I have been in Kalathia sir's team as a group mentor since 3 years. We do the repertory sessions and we learn the repertory skills. I joined as a student 3 years back and today I am here as a mentor. I'm very, very grateful to Kalathia sir for doing this selfless group and teaching students and giving me the confidence of practice poetry and the rubrics. So let's begin. Today I am going to share you 3 cases. There is some similarity as well as at the end of the 3 cases you would see how there is subtle difference and how different they are. Like using the repertory skills, the chief rubric is going to be the same in all 3 cases, but you will see how we differentiate the 3, our knowledge of materia medica and the repertory. So this is the first case. This is a case of a little girl who comes with chief complaints of headache, tension headaches, and so she's a 9-year-old girl who was brought to me by her parents with the chief complaints of tension headache and behavioral disorders. And her basic nature was, I think this is too big. I think you are not able to see the, let me, yeah.
Click on last button. Yes.
Now this is good, right? Okay. So this is a case of a 9-year-old little girl who was brought to me by her parents with chief complaint of tension headaches and some behavioral problems. So I asked the parents what is the nature, like basic nature of the kid, and also tried to get the nature from the case taking of the girl. So she was very kind of hyperactive kind of a girl, and she was not letting others to talk. So her basic nature was, she said, I feel lonely. She said, nobody wants to play with me. When I asked her during the case, what, like, I had to ask, and then she told me during the case that when she's in a group of friends, the friends don't want to include her, and they leave her out. They try to not include her. They try to ignore her, and she feels very ignored and rejected. She says that I try to play with them, but they leave me out in dance class also. She said friends say that I am very annoying. So she also knew that her friends are talking about her, that she's annoying kid. Like her mom said, when she's with her friend, she's with one of her friends, that is fine. But if she is with 2 or 3 friends together, then there is the issue. So she tries to interrupt and she tries to be bossy there. And she says, I'm very talkative. I talk so much so that I get included. So I asked her, why do you want to, like, what is the thing? So her inner nature was like, she is trying to get attention. She wants to talk so that people observe her, people give her more attention. So she was like attention seeking. And her mentals are like talkative to get attention, to an extent that everyone avoids her. So it was getting too much. Then people started avoiding her. She will try to show off that I know better than you. Like she would be bossy. She would be like arrogant. Even she would tell to teachers that, so she would correct even the teacher, like that teacher, you're wrong, I'm right, like that. Sometimes she will act so silly and foolish, and she will laugh and giggle for no reason. She will talk to herself also. So mother says she's like a little adult. She decides which restaurant to go, and if we don't listen, then she gets upset. She interrupts all the time. Teacher says that she is good and smart, but she argues with the teacher and she tries to prove her point. She does not want to listen to what is being told. And while playing also, it happens that if things don't go according to her wish, she gets a very upset. She wants all the attention. And this all started and increased after the birth of her younger brother. Her mom says that I was not able to give her much time when her younger brother was born. But still, even when I hug her, she would push me away, and she pretends as if I don't want any attention. She is very impatient. If she wants anything, she needs it immediately. So this was her basic nature and constitution. And her physical complaints were, I asked about her chief complaint, that was her headaches. So her physical particulars of the chief complaint was frequent. She would get the tension headaches, and these were very frequent. And tension headaches in a school-going girl was something surprising. And it was very severe, and she described the pain as if she said, I asked her, where do you feel the pain? She said, I feel it in the eyes, behind the eyes. So behind the eyeball. And she even gave the sensation of something is pulling with a string inside the eyeball. And the pains were extending to the back of the neck, nape of the neck, and occipital region. And also, when I asked her, when do you feel the headaches more? She said, after reading books or after looking at TV for a long time. So basically, when she would strain her eyes, the headaches were more. And it was aggravated by touch, it was aggravated in the evenings, and it was better by pressure. So these were the LSC, so location, sensation, modality, and concomitants. So these were the rubrics and taken, and I have taken according to the Burning-Hussein's method. And then we see tension headaches, heaviness in the eyeballs, extending to the occiput, sensation as if string is pulled from eyes, aggravated by touch, evenings, reading and eye strain, aggravated especially more on left side, and better by pressure. So friends, what do you think would be the remedy here, and how do we go about it? So any clues? Anybody would like to please type in is there a chat box, sir?
Yeah, chat box is there, but you need to go back. So better you open your microphone and talk live, no problem, but one by one.
Okay. So anybody would like to share? All right. So this was a case from plant kingdom, because here we see there was lot of sensitivity and reactivity. So she was sensitive to the emotion that people are ignoring her. She's feeling rejected, right? And she was feeling excluded. She was not feeling included. And how was her reactivity? She was trying to act in such a way that she would get attention. She was trying to act foolish. She was trying to act active, hyperactive. She was trying to grab attention. And so this was her reactivity. And the chief sensitivity here was the feeling of being excluded, not included, neglected. So this was the case. And so this was cracked with sensation method, where so the remedy given here was Paris quadrifolia. So Paris quadrifolia, where do you think it belongs in the plant chart? Anybody? So, okay. So Paris quadrifolia is a plant remedy which belongs to the liliflorae. And you can see the rubrics first. So the rubrics taken here was talking foolish, loquacity children in discontented surrounding with his, forsaken feeling, egotism, childish, cheerful, tension, brain, exertion of eyes, aggravation, pain, head, occipital region, mental exertion, aggravates. So now, and the follow-ups were amazing. So the during the follow-up, the patient's parents reported a drastic improvement in the girl's behavior. First of all, she started calming down. She would listen to others. She wouldn't act silly. And the chief complaint of headaches was also significantly reduced. So the intensity and the frequency of headaches had significantly reduced. So let us learn about this remedy, Paris quadrifolia. So this is the plant where you see the bud.
But Smita, just wait. I have an open question to all. Which other group of remedies are very similar to lily flowery? Who has a issue of including, excluding, so need to belong to the group. So which group of remedy we can think? A group of remedy we can think.
Yes. If anybody wants to answer that.
Sir, the mammals?
Yes.
Yes, mammal.
Correct.
Very good. Anybody else? Any other group?
Old age or people who belong in the right side of the periodic table or the chart.
Okay.
Yeah, that also we can say, because there is leprosyphilitic miasm there, like feeling of being excluded, not included on the right side of the periodic table. Very good.
Yeah.
What else?
What else?
Okay. Even there is snakes, right? The snakes also have that feeling of not being included, people putting them down, not so they feel that they have wrong suffered, right? So mammals, snakes, right side of periodic table. Good. And lily in plants.
One more group is there, bird remedies. Birds are also have a desire to belong to group. So whatever the medicine which has desire to belong to group, they also have the similar issue of being excluded and not belong to some entire group, right? But specifically the bird remedy, the snake remedies do not have excluding kind of sensation. It's because of miasm. There might be, you find like people not like you or people not include you, but it's not. They are not social at all. So we do not find sociability issue in snake remedies. But in birds and mammals, sociability is highly intense, as like lily flowery in plant remedies. So these three groups are very similar. Another group we found in plant remedy is malvelis, chocolate family. So in chocolate like remedies, gossypium and all, hebelmoschus, all, they also have intense desire to be with others. So desire for company is very, very strong in malvelis also. Okay, go ahead. Now we try to understand Paris from Materia Medica point of view. Yes, go ahead.
Yes. So this is the bud of it's a berry. So it is the common name of Paris quadrifolia is one berry. It's the family is Liliflorae. Plants use this whole plant when in fruit. The miasm here is typhoid miasm according to Dr. Shankaran sir. And the action of the remedy is on mind, nerves, spine, head and eyes. So this is the picture from Shankaran sir's book Plant Sensations, and this is Liliflorae. So you see how the girl felt forced out, excluded. So this is the chief feeling, the key sensitivity of the remedy here. And there are other remedies in this group like Veratrum album, Veratrum viride, Colchicum, Sarsaparilla and Crocus. And as we know that this is monocot, this belongs to monocot and in the 6th subclass and King series. So why we are seeing King series and 6th subclass? Because the patient here we can see that she was very haughty, she was very arrogant. She would want her things to go according to her wish. She would get upset if people don't listen to her. And but she belongs to monocots because her key sensitivity was only towards herself. Like she was not everything was for her. Like she was not in the thoughts of, like, she did not think about others. It was only about herself. So according to Soul of Remedies, Paris quadrifolia is a plant that has an isolated bud with 4 leaves. It is called one berry. One could correlate the appearance of the isolated bud on the top with the isolated feeling in Paris feels solitary. Paris is the situation of only child in the family. Everybody else is an adult, and they're all busy and involved in their own work. They talk strange things which he cannot understand. Thus he feels isolated. He gets all the basic necessities like food, toys, etc., but he does not get the attention. Not so much in the sense of love and care, but in sense of importance and entertainment. He has no playmate. Nobody really talks with him for long or plays with him. He is pampered and spoiled, but has to spend a lot of time alone. As a result, he talks to himself. So this is given in Soul of Remedies. And here also it was the same feeling. This lonely child tries to seek attention, tries to attract by silly behavior. When all the adults are sitting talking amongst themselves, he goes and speaks in a foolish. This is all given in Soul of Remedies again. He is attention seeking in a quite childish and foolish way, but is quite happy with his own talk. An adult in Paris state feels inferior, so he talks in a way that will be egoistic but foolish in order to attract attention. He can also be contentious, censorious, and haughty. So here the chief rubric which I want you all to see is ailments from scorn or scorned being. In Fatak it says ill effects of injury. What is this injury about? It's not the physical injury, it is the emotional injury. They feel as if people are trying to push them and their emotions are being suppressed. Then talkative, intelligent, foolish behavior, forsaken feeling, egotism, haughty, childish, and cheerful. So please remember this ailments from scorn being, because our next case and the third case will also have the rubric. That is a thing which I want you to see how we can differentiate when the chief rubric is same, but there is subtle difference in the remedy understanding. So let's see second case. Now this is a case of psoriasis. So this was a girl brought to me, a 12-year-old girl who was brought to me by her mom with complaints of psoriatic eruptions on both her elbow joints. She started getting these eruptions when she was 6-year-old, and there were symmetrical scaly patches on the flexures of the elbow joint and also little on the nape of the neck near the hairline. She used to feel embarrassed to wear short-sleeved shirts, as her eruptions would be seen on her elbows. She felt everyone dislikes her due to that. So again, here the feeling of being embarrassed and people not liking her was there. She would feel embarrassed and she would try to wear full sleeves even in summer. So she was trying to hide the eruptions. Now let's see how the mentals were. So the girl was very quiet and reserved. She did not express herself much even to her parents or sibling. Basically an introverted girl who had very few limited friends. She was shy with strangers. She wouldn't want to remain by herself rather than being in she would want to remain by herself rather than in company. So she was introvert and reserved. She did not like much company. Emotionally, she was attached to her parents and she could not leave her mom even for a single minute. She was completely dependent on her mom. She was sensitive. She would get hurt easily, but she would not show her tears to anyone. She would keep things to herself. Consolation aggravates. She gets angry easily. She would hold grudges. She does not forgive. So she would, if something goes wrong, she would feel the hurt. She wouldn't express it, but it will remain in her mind for a long time. She cannot forgive easily. And she will brood inside. Like, she does not like to show her tears to anyone. And physically, she was a lean, thin girl who eats well, but she does not put weight. She had a very oily skin, especially on her faces, on the face, and all her complaints were aggravated by sun, the heat of sun, and she also would get headache during the sun. Her drips were dry and parched, cracked, and she had a craving for salty food. So, what would be the remedy here? While case taking, there was like she was very she did not express any any guesses here, and then I can
Hello,
then I
madam.
can
Madam,
yeah
yeah, the remedy can belong to the natrum group, and if she is
yes
hot and thirsty, we can consider natrum mure.
yes good. Anybody else? Any any other remedies which you can think of here?
I'm thinking of same remedy, natramur and some sort of silesia.
Okay, good.
But natramur is still my first choice. We can do the DD with silesia.
Yes, good. So perfect. The remedy here was natramur. It was very clear-cut natramur, but here we would like to differentiate with the kingdoms. So obviously the kingdom here, like we couldn't see any plant-like sensitivity. I could not take, like I could not see any animal talk. If there was subtle animal language like comparison or the need to be beautiful, need to attract, or kind of like animal talk is like comparing to others. So there was nothing of that sort. If there was a subtle thing, I could have even thought of mollusk group of remedies, because she was quite like that. Like she was very introvert, reserved, doesn't want to go out, wants to be indoors, like that kind. So first thought was a mollusk for me, but when I tried to differentiate, like it was plain natrimur. So these were the rubrics taken again here, as you can see. So mind scorned general ailments from being. So I told you, right? So in the last case also, ailments from being scorned was there. And here also again we see mind scorned ailments from being. And skin eruption scaly, flexures, sun aggravation reserved, food and drinks salty food desire, dryness of lips, offended easily, and anger consolation aggravates. And this was the before, during, and after pictures taken. So in the before, you can see the eruptions in her flexures of the joints. During was still better, and then after, at the end of the treatment, she was doing much better, and there was no recurrence of the eruptions. So patient was doing much better. Itching had significantly reduced. Natramur 200 once a week initially, later prescribed in different potencies as per the level of presentation of complaints of the patient. Patient improved within 6 months of treatment, and there were no patches, new patches seen. So here, the patient typically shows features of mineral kingdom, natrum line issues, nurture, ego, insult, self-image, stage of infancy, and total dependency. Here we ruled out animal kingdom as there was no animal language, no comparison. We ruled out plant kingdom as there was no acute sensitivity and reactivity. Okay. So shall we go to case 3? And then later we can take questions. After the end of 3 cases, we can take questions if at all. So this is a case of PCOD. So this was a case of PCOD in 13-year-old girl who came with chief complaint of skipping periods, delayed and suppressed menses, excessive weight gain and unusual facial hair growth, acne and low self-esteem. So here the patient's name has been changed due to confidentiality reasons. Patient Sita started skipping her periods, started to put on weight as she approached her puberty. And Sita felt ignored in the class. So why I have given Sita? Because she also had a twin sibling called so Geeta, for example. So there was always comparison, always in her talks during the case taking. I felt there was always she was trying to project how low she was feeling when compared to her twin sister. And her twin sister was extrovert, bubbly, cheerful, like that. And she always said that I am introvert, I am reserved, I'm not that confident. So Sita felt ignored in the class. She also felt, okay, have we skipped one of the slides? Okay, Sita had a twin sister, Geeta, who was more beautiful, thin, active, extrovert, whereas our patient Sita was obese, introvert, shy, timid, and laid back. When I took her case, I realized Sita suffered from very low self-esteem. She constantly kept comparing herself to her twin sister, Geeta, in each and everything. She felt ignored in her class. So again, you see, there is a feeling of being ignored. As compared, like when we saw the first and second case, there is also the same feeling here. She also felt that other girls in the class used to talk bad about her behind her back, and she did not want to be in the group. But here, she did not want to be in their group. She felt excluded, left out, alone. She believed she was ugly, not good enough. She had no talents, so people did not appreciate her. Like, she tried, she liked company, but she was also reserved. She was very emotionally sensitive, shy, timid, but one who enjoyed being with people. But when people don't give her importance, she would feel left out. She was introvert and reserved. Also, she craved for company. She would get angry easily, but she would not express her anger. Again, little bit like Naitumu, right? Never would express her sadness. She was good in academics. She tried to be good in the good books of teacher. Always want to impress her mom, whom she was very much attached to. She was very caring and affectionate and helpful. She would not hold grudge. So here we differentiate with Natrumur. Here she is not like she would keep the grudge. She would not forgive. She is not like that. If anybody says, then she would immediately, like, she would do anything to be included. Like, she wants that inclusion in the group. She wants that company, but she is feeling left out. Always would put others first before her. People pleasing nature. The thermals, hot patient, and would sweat easily. So what do we prescribe here? How do we go about this?
Madam, again here the patient, she is not showing signs of aggression as such. So again there is a sensitivity. So it suggests a plant remedy as well. And we can think about, not a plant, I think Calcarea group we can think about.
Okay. So Calcarea group in plants, what does it correspond? So, but in the case taking, there was lot of comparison with her sister. And
Can
she
I
also
speak?
said, yeah, go ahead.
I think there was a sibling rivalry, and if there is comparison, then and people pleasing nature, and I'm thinking of lacanum, and lacanum would be my first choice, and that's my only choice.
Okay, good.
Hello, Dr. Smita. Looks like an animal language to me. There's a lot of comparison. And
Yes.
I feel there's cancer masm because she's putting others' needs in front of her. Anger element, I'm not seeing that much, which is very prominent in Laccananum. But yeah, there are low self-esteem issues. So maybe something closer to Laccananum as well, which when
Yeah.
I would go with an animal remedy.
Okay, good. All right. So here, remedy prescribed was Laccan. And Laccan, because so we have been learning PEM method also, and according to PEM also we can see, but many of the students here may not be knowing PEM and Mahesh Gandhi sir's method. So I wouldn't go in more details of that. So here we can see. So this was so the patient was emotionally sensitive. She wanted to be in company. She always compared herself to her sister. This shows themes of animal kingdom and in particularly the mammals. She was very much attached to her mom. And there was comparison and that means there was issues of hierarchy. So this is mammals. So, yes. So Lacan has a feeling of being looked down upon others. She desires appreciation, needs to be part of group or a family, needs to please others to be accepted, angered easily and anger suppressed. So there was a feeling of being looked down. And so when she shared her, she had written actually an autobiography on herself. She had a flair to write also, which her mother shared to me, and in that, that helped me very much to come to the remedy, because in that she had very nicely described that I'm just like a small violin. She was influenced by some of the song. I don't know what song. She had mentioned that song, and that I'm like that, and I am just like a tiny violin. Although people will not see my good things, I am very tiny, and people don't see my good qualities. But why don't they see? I know that I am not that big, I am not that good, but also people need to understand that everybody is having certain qualities, and everybody they should give importance. Like that was her inner nature. Like she wanted that. She knew that she is low. Like the feeling of Lacan is that he himself also feels low. People are putting him down, but also the inner feeling is low self-esteem in Lacan. If if the case was like people are putting me down, but I am not that this thing. If there is no low self-esteem, I would have thought of some other remedy in animal kingdom. But here, the the feeling of being put down and also feeling worthless. So this was the case, and also Lacan acts wonderfully on hormonal issues. So she had PCOD, and menses were late and suppressed, enlarged ovaries, tumors, cyst ovaries. So these were the physical rubrics taken. Also, Lacan helps it with acne. So that is my clinical experience. I have been using Lacan for many hormonal problems. So after Lacan 200, within couple of days, Sita got her menses, which was suppressed since few months. Her acne started reducing. She started becoming more active. Major change her mom felt was in her personality. Now she was more positive. She did not compare herself and her sister. Her confidence had increased. Her confidence level was increased. And Lacan was repeated infrequently, and we went up to 1M and 10M, and in between followed by SL. And this was the message. After 2.5 months, her mom had messaged me that, during the follow-up, she had messaged that she got her periods after 2.5 months, and the cramps and the breast tenderness before periods. So all these are subtle things which you can observe during case taking. She also had these cramps during before periods, breast tenderness. All these suggest that it is going to be a mammal remedy. So before periods, this was also reduced and the pimples are clearing also. So this was very good, and she also gave a Google review for me and at the end of the treatment. And when we compared her, the blood levels, the hormonal levels, the testosterone and the estrogen levels, those were also in good limits. And the DHEA which was increased before, it was very much normal. I can't share here because of the laws of Ontario. We cannot share anybody's blood work reports like that. I will have to take their permission, so I'm not sharing the blood work here. So yes. So what do we see in all these three cases? So we see here in all three cases, our chief rubric was delusion scorned being or scorned general, ailments from being. But the presentation was different. The kingdom analysis was different in each case. The first one belonged to plant kingdom, where we saw like extruded feeling and the sensitivity of plants, like in lily flore. And the second one was the mineral kingdom, again ailments from being scorned. So natrimor, we wouldn't think in ailments from being scorned, but to my surprise, when we put that in repertory, natrimor stands 3 marks. And the third one also belonged to animal kingdom with the same chief rubric. So you see how homeopathy is an art, and how how we can practice this art with knowledge of materia medica, the knowledge of repertory, kingdom differentiation, the miasms, the sensations, everything. If you know, it helps to come to the simillimum, and it's really an art. And I'm so grateful that we have such eminent teachers in homeopathy, Shankaran sir, Mahesh Gandhi sir, Kalathia sir, and all others, from whom we have been constantly learning. We get the opportunity to learn. Even sir's Kalathia sir's mammal books, which I refer always, are very good source of materia medica. So I would definitely recommend to anybody to buy those books. And yes, thank you. This was my presentation, and if you would like to have any questions or anything, we can discuss.
Yeah. So, important thing we learned today is one very important rubric: delusion scorn being, or element from being scorned. So what is my open question to you all? What is the meaning of scorn? SCORN.
Yes, anybody?
Any idea?
So scorned is feeling of being rejected, not included. So in a contemptuous way, like rejected by others. That is being scorned.
Yeah. Any other understanding you have about scorn? Person always have feeling. Yes, go ahead. Who was talking? Yes, Anam, go ahead.
Disrespect, sir.
Yes, this is important. So with scorn, always you find ego. Person feel insulted. Person feel indignated. When somebody is scorning you, means speaking you in harsh language or any way person with a behavior attitude, you feel like person is not welcoming you or you have no value, not appreciating you. This is a combination of emotions together. So when this all combination you found in your case, then you can take this rubric as a main rubric, and along with that whatever you find peculiar in your case, put them in repertory and you find the medicine. This is one way to select the medicine. Along with that, if you try to understand the patient, then you can combine these rubrics along with your understanding, and whatever 5, 4, 10 medicine that comes very strong in this all rubric, you can easily select. So this is importance of group themes. If you know the groups, what is plant, what is animal, what is mammal, what is snake remedies, what is Calcarea line, what is Kali, what is natrum, then you are able to decide the medicine, because in repertory it gives you the bulk of remedies. Not it repertory is not repertory chart is not going to make a decision for you, right? So if you have to select a one medicine from this entire group, then you require a certain knowledge, either a materia medica knowledge or this kind of a thematic knowledge. So themes of any group, and then you can easily select the medicine and it going to help you. So if singly, if you go with only repertory, suppose you put all the rubric and first medicine coming up is pulsatilla and you give pulsatilla, that will never work. But if you combine your understanding along with repertory, whatever the base you have, it's a sensation method or a group theme, or it's a Vitulka's method, or it's a Vijayakar method, Sehgal method, mind method, whatever it is. But when you combine these both the things, then you have a better success in your cases. And most of the time, this way the selected medicine is work very well. So this is the message today, and this is the learning we have today. Like along with repertory or your knowledge of materia medica, if you combine something else, then you have better results. And we learned this con rubric today prominently. So this was the learning, the focus of the entire talk. We selected three cases. Dr. Smita selected three cases which has a very similar expression but belongs to three different kingdoms, right? Heteromuris look very similar to lichen and also similar to that Paris. So when you see this kind of all combination, you see very well. And what is another learning? Suppose you have given an atramure and your medicine is not working, and you are looking for something similar medicine from another kingdom, then you can think of lichen, because this is the you can say the one kind of evidence we have, because similarity is going to help. So these are the, you can say, the companion. So companion of lichen is natramure and natramure's companion is lichen. So this way also you can think. So you need to be open and you need to think wise in your cases, then only your selected medicine is going to help. Because we all have difficulties while facing a follow-up, and we had put in first case taking a lot of effort and our base selected medicine is not going to work, then we have a lot of tension, anxiety. What to do next? Either we change the potency, retake the history. So if you have this way of comparative study, you know the companion of each one, then it's going to help you a lot. And after confirmation, you can select that a similar medicine. So we all know, like Calcarea, the belladonna is acute of Calcarea. Same way, there are many medicines have their acute and chronics, right, in our materia medica. So that relationship also you can use. Suppose your medicine is not work, then go to their follow wells that way. So this knowledge of this relationship is very, very important to handle cases. First decision or the first prescription is not the game over, right? You have to handle the case entire till patient have recovery. And even your base selected medicine sometime not going to work. So when you have this kind of additional knowledge, additional understanding, it is going to help you a lot. So this was the message today from Dr. Smita. Any question? Anybody have any question regarding today's session? Okay, friends.
Yes.
Then let's.
So it was an amazing
Yes.
session. It was an amazing session, and we liked all the 3 cases. So thank you, sir, for bringing Dr. Smita on this platform. It was very enriching.
Okay.
Thank you.
Yeah.
Sir, it seems that in one word, regulatory suggest and medical selects.
You need to speak again because some humming is there. Speak again.
The repertory suggest and medical selects.
Yes, correct.
Yeah.
Very
correct.
true.
Yes. Very good cases, madam.
Yeah.
Thank you so much for a wonderful session, sir. Thank you. Thank you very much.
Yeah.